Bonjour tout le monde. Today, the Minister of Intergovernmental Affairs will be joined by the Minister of Health and the Minister of Public Safety and Emergency Preparedness, as well as Drs. Tam and Njoo to make some brief remarks before taking questions. Nous entendrons d'abord de brèves adresses de la part de nos participants, qui seront suivies d'une période de questions et de réponses. Minister LeBlanc, over to you.
Alors, merci beaucoup. Bonjour tout le monde. Today, as was noted, I'm joined by my colleagues Patty Hajdu and Bill Blair, and in Ottawa, Dr. Tam and Dr. Njoo. Across the country, premiers and local health officials are having to make difficult decisions in the lead up to Christmas. We need to remain vigilant as a country. Les Canadiens doivent aussi prendre des décisions difficiles. Ne pas avoir de fête comme nous avons l'habitude de faire, par exemple. Since March, the Prime Minister has held 23 First Ministers' meetings. Our government has been in regular contact with every Premier, and we've committed to Canadians that we are there to support them throughout the pandemic. It is why our government has contributed 8 out of every $10 spent fighting COVID-19. It is why we have supported Canadians with the Safe Restart Agreement, why we have bought personal protective equipment, and why we have committed to paying 100% of the cost of the vaccine for Canadians. We have said we would be there for Canadians, and we have been, and we will continue to be for as long as it takes. I would now like to invite my colleague, Patty Hajdu, the Minister of Health, to say a few words. Patty.
Thank you very much, Dominic, and thank you very much, everyone, for being here. Since last Sunday, when we announced that flights coming from the UK were suspended, experts and scientists of the Government of Canada have been gathering more information about the new strain of COVID-19. Dr. Tam and Dr. Njoo will speak about this further, but I can tell you the whole research community is at work to better understand the potential implications of this new strain here in Canada and, of course, around the world. And the decision that we made to suspend flights illustrates just how quickly things can change because of COVID-19. I think it's also an important reminder to all Canadians about why we continue to recommend avoiding travel. Travel increases our exposure to others. It also increases others to us. Travel is also clearly unpredictable as the world battles COVID-19 and countries continue to make decisions and change policies as they adjust to their own local and international circumstances. So please don't plan to travel internationally if it's not for essential purposes. Avec les décisions que les pays doivent prendre à cause du virus, tout peut changer rapidement. Nous recommandons donc toujours de ne pas voyager si ce n'est pas pour une raison essentielle. And if you've returned or you have family members that are returning from international travel, I remind you again, the mandatory 14-day quarantine is there to protect our communities and families. I also will remind everyone to continue to follow local public health advice. Despite that fact that many things change quickly, we actually all have power over the virus. We can choose to stay safe and free of COVID-19 and contribute to ending this as soon as possible. Now, I know that the holiday season is a hard one for every family, every community. We're all making sacrifices. We're foregoing parties. We're reducing our gatherings. So please consider the ways that you can protect your loved ones and your friends while also supporting each other through this challenging time. Gather virtually. We're all a little sick of Zoom, but one more call helps people feel connected. FaceTime the people in your life that are alone. Drop off care packages and gifts at the door. Because your way of adapting these holidays is going to save lives and make sure that we're all there to celebrate again next year. Finally, this has been a really hard year for all Canadians. But in true Canadian spirit, we continue to be there for one another. And I offer a special thanks to the healthcare workers, the pharmacists, the IT workers, and essential workers all across our communities that are keeping our lights on, keeping the food on the table, keeping us connected. and keeping us healthy. We're all so grateful to you. And my wish is that everyone gets some rest over the next few weeks. Thank you very much.
Yeah, merci beaucoup. Merci beaucoup, Patty. Alors, on demandera maintenant à notre collègue Bill Blair.
Thank you very much, Minister LeBlanc, and I want to thank you all for joining us here today. We are now more than 3/4 of a year into the global pandemic, and Canada continues to take unprecedented action across the country and including at our border to limit the spread of COVID-19. A range of screening and security measures remain in place for all travelers, and the requirement to quarantine remains in effect. I believe that the restrictions that we have imposed at our border, particularly as it pertains to international flights, are among the strongest and most rigorous in the world. We are one of the few countries in the world that restricts all non-essential travel from international destinations into Canada. And the Government of Canada continues to enforce and strengthen those measures as needed and as the global situation evolves. Most recently, for example, in response to an evolving situation in the United Kingdom, we have closed our borders to all flights entering Canada from the UK. That suspension of flights remains in effect as we speak, and we are reviewing additional measures that may be required. I want to advise you that enhanced screening has been put in place at all Canadian airports and at all points of entry for travelers who may be arriving from the United Kingdom indirectly. They are, in every case, screened for having been in the United Kingdom in the past 14 days. And if they have, they are referred to the Public Health Agency of Canada at both land and airports of entry. Let me reiterate that all travelers entering Canada are subject to COVID-19 entry screening, regardless of their country of origin or their mode of entry. And unless they are exempt, anyone arriving at the border must isolate for 14 days or if they have symptoms of COVID-19. And they must quarantine if they do not have symptoms unless they are exempt. And let me speak very briefly to the issue of exemption. The vast majority of people who are exempt from the quarantine restrictions are truck drivers, people who are doing the essential work of bringing much needed supplies and goods in and out of our country each and every day. All travelers are also required to provide their contact and quarantine information. And I want to advise you that these mandatory quarantine measures put in place by the Public Health Agency of Canada have been effective. COVID-19 cases related to international travel currently account for only 1.8% of all cases. That means 98.2% of COVID transmissions are a result of community transmissions, not international travel. And travel from all modes of travel are even lower. We have been doing the work necessary to keep our communities safe. In addition to the screening measures for travelers, the government has also dramatically scaled up the federal public health presence at the border. That presence now covers 32 points of entry that account for the vast majority of traffic into Canada during normal operations. A total force of 179 public health officers are now deployed right across the country at various points of entry. The Canadian Border Service Agency has also put in place measures to assist the Public Health Agency of Canada in their efforts to monitor and enforce compliance with the mandatory quarantine and isolation orders. Border service officers are required to ask very specific questions to determine whether they will be in contact with vulnerable persons. Currently, approximately 100 designated screening officers at a call center make approximately 4,300 live calls and 3,500 automated calls each and every day, for a total of nearly 1 million contacts since March of this year for travelers entering Canada. These calls are being followed up by local law enforcement, the police of jurisdiction, if an individual cannot be reached, or if a traveler is suspected of not complying with the very rigorous quarantine requirements. And finally, it's also important to note that these temporary restrictions on non-essential travel remain in effect across our borders. All decisions related to the border are made with the health, safety, and security of Canadians as our first and greatest priority. I look forward to continuing to working with all our partners, making sure that the measures that we take at our borders remain effective and in accordance with the latest public health advice. Thank you very much.
Merci beaucoup. Thank you very much, Bill. And over to you, Dr. Tam and Dr. Njoo.
Bonjour, good day, everyone. Bonjour à toutes et à tous. There have been 515,314 cases of COVID-19 in Canada, including 14,332 deaths. Nationally, there are over 77,360 active cases across the country. And yesterday, 6,381 cases were reported nationally. In addition, there were almost 1,140 new cases reported for Saturday and Sunday. So this brings the average daily case count over 6,630 cases for the past week. And the number of people experiencing severe illness continues to increase. Over the past 7 days, there were an average of almost 3,200 individuals with COVID-19 being treated in Canadian hospitals, including over 650 in critical care, and an average of over 110 deaths were reported each day. To date, Canada has not identified the new variant of the coronavirus under investigation in the United Kingdom. As 2020 draws to a close, our thoughts are with everyone who has faced struggles this past year, and especially those who've lost a loved one during the COVID-19 pandemic. I also want to acknowledge the incredible dedication and caring of Canada's healthcare and public health workforce, along with members of the Canadian Armed Forces. I know that many across the health workforce will continue to be there for us over the coming holiday period, sacrificing time with their families to protect our health and safety. Seeing many of you and those you care for receiving the vaccine this past week fills me with hope for the new year. To be sure, challenges remain, but with broader vaccine rollout on the horizon and reflecting on what we accomplished by working together, I know that we will be able to overcome whatever comes our way. So looking back, another inspiring aspect of this year has been the outpouring of kindness and goodwill from Canadians across the country. The examples are far too numerous to recount, from the many who've made and donated homemade masks or delivered food and care kits to others in need, to kids of all ages coloring cheerful signs and pictures to lift people's spirits. Goodness and caring has been all around us. It even generated caremongering as a new uniquely Canadian word in 2020. And this spirit of giving continues to grow. Businesses have been involved in retooling their manufacturing to supply hand sanitizers, PPE, and respirators. And some of the latest examples include Canadian businesses lending specialized ultra-cold temperature freezers to local public health departments to enable them to store our vaccines. And to that, the incredible work Canadians have contributed on a national and global stage, from researchers and others working around the clock on all aspects of laboratory diagnostics, vaccines, and treatments, to planning and logistics experts who are ensuring coordinated and equitable rollout of vaccines, and the countless small kindnesses of Canadians protecting each other. Throughout, our essential service workers helped our healthcare system to cope, keep our grocery stores stocked, and our communities supplied. Looking forward, there is a lot to be hopeful about. There are safe and effective vaccines in our midst, and until there are vaccines for all Canadians, our public health measures can work to control COVID-19. But I have one big worry, and only a continued commitment from all of us can allay this concern. Currently, Canada remains on a trajectory for an even stronger resurgence over the next 2 months, and this is a perilous time. Public health measures to reduce the infection rate only work if we all adhere to them to the best of our ability. An infections rate remains very high in many areas of the country. That means we must celebrate holidays differently this year and carry on with our public health practices through the coming weeks and months. And in this time of giving and New Year's resolutions, let's all commit to continued efforts as a show of collective appreciation and gratitude for frontline and essential workers, as they continue to care for us through the holidays. Following public health advice, plan safer holidays, stay home if you have any symptoms, and practice physical distancing, frequent hand washing, and wearing a mask as appropriate. Thank you.
Bonjour à toutes et à tous. Il y a eu 515 314 cas de COVID-19 au Canada, dont 14 332 décès. À l'échelle nationale, il y a plus de 77 360 cas actifs. Hier, 6 381 cas ont été enregistrés au pays. En outre, presque 1140 nouveaux cas ont été signalés par les journées de samedi et dimanche. Cela porte le nombre moyen de cas par jour à plus de 6 630 au cours de la semaine dernière. Le nombre de personnes gravement malades continue d'augmenter. Au cours des 7 derniers jours, en moyenne, 3 200 personnes atteintes de la COVID-19 ont été traitées dans les hôpitaux canadiens, dont plus de 650 se trouvaient aux soins intensifs et plus de 110 décès ont été signalés en moyenne chaque jour. À ce jour, le Canada n'a pas rapporté de cas liés au nouveau variant de coronavirus qui est en cours d'examen au Royaume-Uni. Alors que l'année 2020 touche à sa fin, nous pensons à tous qui ont dû affronter des situations difficiles au cours de l'année écoulée et en particulier à ceux qui ont perdu un être cher en raison de la pandémie de COVID-19. Nous tenons également à souligner le dévouement et l'attention extraordinaire du personnel de soins de santé et de santé publique du Canada, ainsi que des membres des forces armées canadiennes. Nous savons que de nombreux travailleurs de la santé seront en poste pendant les temps des fêtes, sacrifiant du temps avec leur famille pour protéger notre santé et notre sécurité. Avoir vu beaucoup d'entre vous et ceux dont vous vous occupez recevoir le vaccin la semaine dernière nous a remplis d'espoir pour la nouvelle année. Certes, il reste des défis à relever, mais compte tenu de la vaccination générale qui se profile et en constatant tout ce que nous avons accompli en travaillant ensemble, nous savons que nous serons en mesure de surmonter tous les obstacles qui se présenteront. Avec le recul, un autre aspect inspirant de cette année a été l'élan de gentillesse et de bonne volonté des Canadiens partout au pays. Les exemples sont bien trop nombreux pour qu'on puisse les énumérer tous. Des personnes qui ont fabriqué et donné des masques ou livré de la nourriture et des trousses de soins à des personnes dans le besoin, aux enfants de tous âges qui ont colorié des images et des signes joyeux pour remonter le moral des gens. La bonté et la bienveillance ont été omniprésentes. Cela a même donné lieu au mot anglais « caremongering », c'est-à-dire incitation à l'altruisme, un nouveau mot typiquement canadien en 2020. De plus, cet esprit de générosité ne cesse de croître. Les entreprises ont également participé à l'effort en réorientant leur capacité de fabrication de manière à fournir des désinfectants pour les mains, des équipements de protection individuelle et des respirateurs artificiels. Parmi les exemples les plus récents, on peut citer les entreprises canadiennes qui prêtent des congélateurs spécialisés à température très basse aux services de santé publique locaux pour leur permettre de stocker nos vaccins. Ajoutons à cela le travail formidable que les Canadiens ont accompli sur la scène nationale et mondiale. Les chercheurs et autres personnes qui se sont occupés 24 heures sur 24 de tous les aspects de diagnostic de laboratoire, des vaccins et des traitements, aux experts en planification et en logistique qui assurent un déploiement coordonné et équitable des vaccins, en passant par les innombrables petites attentions des Canadiens qui se protègent mutuellement. Tout au long de l'année, nos travailleurs de services essentiels ont aidé notre système de soins de santé à faire face à la situation, à approvisionner nos épiceries et nos communautés. L'avenir est rempli d'espoir. Nous pouvons compter sur des vaccins sûrs et efficaces et tant qu'il n'y aura pas de vaccin pour tous les Canadiens, nos mesures de santé publique peuvent contribuer à maîtriser la COVID-19. Pourtant, nous avons une grande inquiétude que seul un engagement continu de nous tous pourrait apaiser. Actuellement, le Canada se dirige toujours vers une recrudescence encore plus forte de la maladie au cours des 2 prochains mois, C'est une période périlleuse. Les mesures de santé publique visant à réduire le taux d'infection ne sont efficaces si nous les appliquons tous de mieux que nous le pouvons. Les taux d'infection restent très élevés dans de nombreuses régions du pays. Cela signifie que nous devons célébrer les fêtes différemment cette année et continuer d'appliquer nos pratiques de santé publique au cours des semaines et des mois à venir. En cette période de dons et de résolutions de Nouvel An, engageons-nous tous à poursuivre nos efforts en signe d'appréciation et de gratitude collective envers les travailleurs de première ligne, les travailleurs essentiels qui continuent à prendre soin de nous pendant le temps des fêtes. Suivez les conseils de santé publique, planifiez des célébrations en toute sécurité, restez à la maison si vous avez des symptômes, pratiquez la distanciation physique, lavez-vous fréquemment les mains et portez un masque lorsque cela est approprié. Merci.
Thank you.
Merci beaucoup, Dr. Njoo. Alors, on va prendre les questions.
So as a reminder, please limit yourself to one question and one follow-up. And please begin by identifying yourself and naming the media outlet that you represent. We're going to start with three questions in the room, and please proceed to the mic. We'll go from here. Mackenzie?
Hi, Mackenzie Gray with CTV News. Not Dr. Tam. I'll start with Minister Hajdu. Can you give us an update on the timeline for the Moderna vaccine? Understanding is that we got all our documents yesterday. Is the assumption that we'll have a approval by the end of the year, or is there any info you can give us on that?
Thanks very much, Mackenzie. I'm hoping that you can hear me clearly. I took the mic off as if there was an unnatural amount of reverb. So let's hope this works well. Anyways, Mackenzie, thanks for the question. Yes, you're right. Health Canada now has all the data required to make a decision. My understanding is that decision will be very soon. Of course, I can't speak for the regulators because obviously they are independent, but they will have information for Canadians in the very near future.
Moving over to the Ontario lockdowns, in Ottawa, the mayor and the public health officials have been very upset with Premier Ford's decision to put the province into a 28-day lockdown. The mayor said he was blindsided by that. Minister Hajdu, when we've asked you about lockdowns previously, you've referenced your hometown of Thunder Bay and saying that the situation in Thunder Bay is different than Toronto, so we need to take a regional approach. In Ottawa, there were 19 cases today. There's no one in the ICU. By all the metrics we have here in Ottawa, the city's doing very well compared to the rest of the province. Do you support the fact that Ottawa and many parts of Northern Ontario are heading into lockdown compared to the fact that they're doing better than Toronto? And for the doctors, in that vein, you've said that people should listen to their local public health officials more importantly than national or provincial. Do you think that this is a messaging concern when a local public health official is giving a very different message than what the province is giving on this?
Maybe I'll start, Mackenzie, and then turn to Dr. Tam. I'll just say this. I think at the federal level, we have been really consistent with saying that people should try to reduce their mobility as much as possible. So, please try not to travel unless you have to do so for work. Please stay home as much as possible. Don't gather, don't have parties or gatherings with friends and extended family. This has been consistent messaging for the government of Canada, largely because we know that mobility increases spread. Now, in terms of Ontario's approach, I can't speak to the data that they're seeing, including their hospital data, which I'm sure they are monitoring closely to determine capacity at hospitals and capacity to move people from hospital to hospital should that need arise. So I would imagine there's a number of data points that they're observing in their decision making. I will say that at the federal level, again, our hope has been that we could have more regional measures applied so that we would be able to keep, obviously, areas of the country that don't have any COVID as functional as possible. But again, working collaboratively with provinces and territories in their own situations. And finally, I'll just say, at the federal level, we've implemented many economic measures to support provinces and territories in controlling the spread, including economic measures for lockdowns or restrictions in very regional areas that would help control wider spread. And clearly, what we had hoped as we were implementing these measures is that provinces would take swift action in areas of outbreak to contain the spread and prevent it from moving onward into even more rural areas. Perhaps I'll turn to Dr. Tam.
I think, as the minister said, that there is consistent messaging around the core public health measures and what each individual should take to reduce contacts. And I think that's fairly widely applicable to everywhere in Canada. But I do think, obviously looking towards local public health advice is very important because of the variations across the country, not just across an individual province. I can't tell you exactly what the decision making was in Ontario, but I do know that in the second wave, one of the concerns is mobility, and the minister said is that people are moving out of the hot zone into other areas as well. So, but it's a question that you may want to pose to the province. But it's just that the contiguous nature of some of the neighboring regions, perhaps. But I think that collectively, public health medical officers have been really concerned about this resurgence that we're seeing. This is a special time. I think it's a time where people would want to move, across different areas of Canada and the province, and it may be that they're trying to, make sure that isn't going to lead to an increased resurgence in 2 weeks' time. But please do talk to the province about their decision.
Oui, bonjour, Philippe Vincent Foisy de Radio-Canada. J'ai une question en français. J'espère avoir une réponse en français aussi sur la sécurité publique par rapport aux voyageurs. On voit beaucoup de gens qui quittent le pays pour aller dans le sud, pour prendre leurs vacances à l'extérieur du pays. À quel point, au cours des prochaines semaines, vous allez surveiller davantage ces gens-là qui rentrent au pays? Puis à quel point il va y avoir des mesures supplémentaires pour faire un suivi de la quarantaine? Vous dites, on fait beaucoup d'appels, d'accord, mais est-ce que vous allez aller faire des visites? Est-ce que vous allez vérifier sur place que les gens font bel et bien leur quarantaine afin de minimiser le risque?
Okay, je vais commencer. C'est Dr. Njoo. Merci pour la question. Oui, c'est sûr, c'est un enjeu actuel pour nous autres ici à l'échelle fédérale. Je pense aussi qu'on sait toujours que les Canadiens ont le droit de quitter de partie du pays. On ne peut pas les empêcher. Mais c'est sûr que tout le monde, les Canadiens qui retournent au pays, c'est sûr ils doivent suivre les mesures de la quarantaine. C'est 14 jours, c'est obligatoire. Il faut montrer un plan pour rester chez eux et tout ça. Donc, on continue à travailler aussi avec nos homologues des provinces et territoires pour assurer que les personnes qui rentrent au pays continuent à suivre les consignes aussi à l'échelle locale.
Donc, vous n'allez pas augmenter les mesures, vous n'allez pas prendre d'autres mesures, vous n'allez pas engager...
toujours à analyser, il y a toujours des options. On suit aussi avec les données probantes qu'est-ce qui se passe, que je pense que le ministre Blair aussi a dit quelque chose avec le pourcentage jusqu'à date. Ce qu'on voit actuellement, c'est vraiment le plus grand problème au Canada, c'est vraiment la transmission communautaire à l'intérieur, au sein du Canada. Ce n'est pas vraiment l'importation des cas, mais oui, c'est un enjeu. On continue à utiliser tous les moyens pour prévenir, contrôler la transmission au Canada. C'est un peu de peut-être importation, mais jusqu'à date, c'est moins de 2 de tous les cas au Canada. C'est vraiment à cause des personnes qui ont traversé la frontière internationale.
Et peut-être, si vous me permettez, je pense que c'est important de noter aussi que actuellement, le conseil formel du gouvernement du Canada, du ministère des Affaires étrangères, c'est de ne pas voyager à l'extérieur du Canada. Alors, pour ceux et celles qui décident de voyager à l'extérieur du Canada, ils vont contre l'avis du gouvernement canadien. On comprend qu'il y a des gens qui peuvent décider de faire un voyage à l'étranger, par exemple. Mais comme le Dr. Njoo a bien dit et comme mon collègue Bill Blair a très bien expliqué, les gens qui reviennent au Canada seront sujets à des mesures de quarantaine très sévères. Beaucoup d'autres pays n'ont pas des mesures aussi robustes que le Canada a à ses frontières en termes de une quarantaine obligatoire pour les gens, y compris les Canadiens qui retournent au Canada. Et comme M. Blair a aussi dit, dans les prochains jours et les prochaines semaines, quand on suit les données probantes, comme le Dr Njoo vient tout juste de dire, on va continuellement regarder des façons de renforcer ces mesures-là, d'augmenter le nombre de vérifications pour s'assurer que les plans de quarantaine sont bien respectés. Et ceux et celles qui ne respectent pas les plans de quarantaine et qui décident de violer les mesures de quarantaine vont faire face à des mesures devant la justice très sévères.
Et sur le 72 heures avec le Royaume-Uni, vous en êtes où? On est à peu près à mi-chemin. Est-ce que vous allez prolonger cette suspension? Est-ce que vous arrêtez après 72 heures? On est où dans cette réflexion-là sur la suspension de tout voyage en provenance du Royaume-Uni?
Peut-être moi je pourrais donner une réponse. Si le Dr Njoo a quelque chose à ajouter, il le fera par après. Évidemment, les mesures mises en place par des mesures nécessaires pour les Canadiens, comme on l'a fait depuis le début de la pandémie. Mon collègue ministre Garneau a empêché l'arrivée des avions, que ce soit commercial ou privé, en provenance du Royaume-Uni. Cependant, nous sommes en train de discuter avec les alliés du Canada à travers avec le gouvernement et les scientifiques du Royaume-Uni, comprendre davantage de données quant à cette mutation du coronavirus. Et au bon moment, nous allons ajuster ou renforcer ou changer les mesures nécessaires à tout moment pour protéger les Canadiens. Alors, on est en train d'évaluer les mesures nécessaires. Dans les prochaines heures, les prochains jours, vous allez voir, nous allons continuer et ajuster aux besoins toutes les mesures nécessaires pour protéger les Canadiens quant à la possibilité de l'arrivée de cette mutation. Mais comme le Dr Njoo a dit, pour le moment, avec les données scientifiques que nous avons au Canada tout de suite, on n'a pas de preuve que cette mutation du coronavirus est arrivée au Canada. Évidemment, nous allons continuer de prendre toutes les mesures nécessaires pour protéger les Canadiens.
Je pense qu'il y a un problème avec votre connexion, M. Leblanc. On comprend presque rien ici. Là. Peut-être juste répéter une partie. Le son est vraiment...
Oui, peut-être c'est Dr. Njoo. Peut-être je peux faire un petit résumé ce que M. Leblanc, ministre Leblanc a dit. C'est sûr, pour les 72 heures, on travaille très, très, très fort maintenant avec nos homologues aussi à l'échelle internationale, avec les autorités de la santé publique au Royaume-Uni, aussi l'OMS, tout pour avoir analysé les autres données probantes. Parce qu'avec avec les données probantes, avec la science, nous avons plus de comme dit, comme des connaissances pour peut-être ajuster les mesures au fur et à mesure comme nécessaire. Really, what we've been doing with the 72 hours is that it's allowing us to obviously work closely with our counterparts in public health, not just in the UK, but also internationally with the WHO and others, to obviously look at the data, what's happening in the United Kingdom, to get a better understanding of the virus, because that will allow us obviously to adjust our measures as necessary.
Mike Couture from Global National. This is a question to Dr. Tam and to the ministers. So, Dr. Tam, you say the variant hasn't been found in Canada yet, but I wanted to know for the ministers and for Dr. Tam, what can you say to Canadians who are concerned that not enough is being done right now to screen for that variant at the airport? And what can you say about the process that's ongoing now, Dr. Tam, to test for it in the samples that we already have, and how few have been tested for that variant?
So, obviously, it's an evolving situation, and we've been very active in the last couple of days and activated all the sort of scientific networks in Canada. So there's different aspects to the genomics information. So obviously, we've been doing sequencing of the viruses that and the samples that we've collected in Canada to look for this lineage, which is called B1.1.7. And so that's the UK variant lineage. And we've looked at well over 2,500 sequences to date, which represents some of the highest quality samples, if you like. We're also rapidly quality assuring a bunch of other samples that's been taken to look at that. And the rate at which we sequence our viral samples is commensurate with the rate that the UK, for example, was sequencing. So they were able to detect in their context this emerging pathogen. But we also linked up with the provincial databases, so BC, Quebec, and Alberta, their sequencing information, and they have not detected this particular lineage and this particular variant. And we also sort of convened the principles of the Canadian COVID Genomics Network. So this is a network that the federal government has invested in, and that includes a huge number of partners across not just public health, but academic and other centers to look at what more needs to be done, as well as the retrospective. We are going to be targeting enhanced sequencing efforts to the sort of high probability samples, like from travelers. So that's, obviously moving forwards. That's part of the strategy as well. We will also be looking at stored samples, any available from travel-associated samples from the last 2 weeks, for example. That is pretty key. And as people know, we've been collaborating with Alberta on a pilot project at the border, and they have also samples that are currently undergoing sequencing, and we should hear about them pretty soon. And also the McMaster Health Labs Ontario pilot. So again, those are travel-related samples, so they'll give us a pretty good concept what's going on. So what we can say is that at this point in time, we have not detected this mutation, but we will, of course, inform people as this goes along. I think many countries in the world, other than the United Kingdom, are doing a similar thing.
And if I could just add to Dr. Tam's answer in regards to importations of this particular virus. I mean, this is partly why we paused all inbound travel to the UK, so we would have some time to consult with our research community. But I just want to remind everybody that the 14-day quarantine measure that we have in Canada is, in fact, amongst some of the most restrictive in the world. So as you saw countries around the world changing their measures at the border in regards to the UK, I mean, other than perhaps a bit of a deeper dive on those particular travelers, we're in very good shape because, in fact, travelers are required to quarantine 14 days, which prevents the onward transmission of a virus, regardless of what variant they might have come into contact with. So that 14-day quarantine has, in my opinion, been directly linked to the low number of importations that we have seen in this country. And of course, it comes with its own challenges from a mobility perspective and sometimes from a trade perspective, as we know. But I do know that we work collaboratively with all provinces and territories and across government ministries to make sure that we can continue to enable our economy to continue working while protecting Canadians from other travel importations.
Follow up?
Mr. Blair is looking to speak.
Yeah, if I may also add, as of midnight on December the 20th, all flights from the United Kingdom to Canada were suspended for a period of 72 hours. At that time, there were 2 flights in the air returning from the United Kingdom to Canada with a total of 301 passengers on board. That includes the flight crews of those 2 planes. Of the travelers who were not essential workers, such as flight crews, all of them upon arrival were directed into secondary at CBSA, and enhanced measures were implemented and imposed on all of those non-essential returnees, including very many Canadians who were returning from the United Kingdom. All of them were screened for symptoms and by observation and by questions by CBSA, and all of them were ordered into quarantine. information that is required for contact tracing and ensuring that all of those individuals had a safe place to immediately quarantine for 14 days was determined by the border service officers. And where there was any question arising, the person was referred to the public health agency officer who was on site at the airport monitoring the arrival of these individuals. During the period of time for which flights are suspended, there will be no more returning flights from the United Kingdom. However, we are implementing additional measures. And for all those entering Canada from any other destination, and it's important to recognize that while, for example, Canada suspended all flights from the United Kingdom, other neighboring countries, such as a number of European countries and the United States, did not. And so we are ensuring that for all people who are seeking to enter Canada, we are screening them for previously having been in Europe during the past 14 days. Every traveler who indicates that they have been in the UK or in Europe for the past 14 days will also be asked about their travel to the UK. If they respond yes, and we can also check that through various travel records through the airlines and their passports, they will be referred to PHAC officials for further assessment, screening, and questioning. And in addition, any traveler who has been in the United Kingdom prior to seeking entry to Canada will be quarantined based on the questions, even if they have used our ArriveCan app. They're all being interviewed directly. I also want to point out that there are significant consequences for those individuals who may think it prudent to lie, for example, to CBSA. There are substantial consequences for Canadians returning, fines up to $750,000 and periods of imprisonment. And in addition, there are very significant consequences for foreign internationals entering into Canada who may lie to CBSA. We believe that the measures that we have put in place for United Kingdom flights and travelers who may have originated there are among the strongest in the world. And our public health agency, public health officers and our border service officers are working very collaboratively and sharing the information on those who've been ordered into quarantine with provincial and local police of jurisdiction authorities to ensure compliance. Thanks.
And as my follow-up, Dr. Tam, I wanted to ask you, how does the discovery of this variant and the possibility of it possibly coming to Canada affect public health guidance and your messaging to Canadians as they see this variation and possibly get more scared about it?
Sure, the public health measures that have worked will work for this variant. So that much we know is that broad public health measures are essentially regardless of what mutations have been sort of occurred in the virus, and viral mutations will continue to occur over time. I think that's something that we need everybody to understand. Modern science has put this virus under extreme microscopic examination so that we're seeing the mutations in real time. And one is to expect this over in the future. But reducing contact, remember this virus is transmitted from human to human, will always be able to slow down viral transmission. I think that some of the studies being done in the UK right now, epidemiologically and otherwise, is to look at, well, why did it accelerate in that country? But they've implemented their public health measures and introduced more restrictive public health measures to try and slow that down. And so that core stuff is essentially the same. The other, of course, work that is extremely rapidly being done right now is to look at, well, does it impact the vaccine effectiveness? So I think that all of the expert opinions to date is that it's unlikely that this mutation is going to affect vaccine effectiveness, but that's still ongoing. So this kind of measures that we have right now buy us a bit more time to question, for example, the manufacturers of those vaccines, Pfizer and Moderna, and what they can do, as well as the international collaborators. But I think that we're sort of expecting that there will be no significant impact on the vaccine itself. But that has to be monitored. And of course, collaboration with the UK is key because they've been rolling out the Pfizer vaccine, and they will probably be one of the first people that can give us some more data on that. But right now, that's, we may remain optimistic on that front. The other thing is that doing significant work right now to look at the diagnostics that we have. What we do know is that our national microbiology labs, PCR and other public health laboratory PCR tests should pick up this virus like any other virus, given that there's multiple targets that we use in our PCR. What is rapidly being done is look at the whole range of diagnostics available in Canada, and just to see which ones may or may not be impacted. So there's quite a lot that's approved by Health Canada. So they're doing lots of work just to check in. But I think any test that looks at multiple targets are unlikely to miss this virus. But if you've got a single target for your test, then that has to be examined.
Just going to note that we have about 10 to 15 minutes left. So we're going to continue now with a question over the phone. Opérateur, première question.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. Our first question is from David Youngren from Reuters. Please go ahead.
Yes, thank you, Dr. Tam. You have said that Canada has seen no examples of the mutated variant. Do you think there's any chance Canada can avoid seeing this, or given the way the world is interconnected, do you think it's inevitable that at some stage we are going to see people with this mutated variant?
I think this is Theresa Tam. So I think it remains to be seen. As I said, to date, we have not seen this variant. We're still looking, and we're still going to be doing more testing and sequencing in the days to come. But it wouldn't surprise me that this variant is in many different countries. So I think that, and it may become one of the more common strains. So, and we know how this virus transmits in sort of hidden ways. And so it's a possibility for sure. But, by having a bit of lead time and getting ourselves set up, we will be able to detect it should it appear in Canada. But of course, what I've just said is the most important thing is we need to know the clinical manifestations of this virus. And so far, the UK is saying that it's not leading to increased severity, but that needs to be verified. And what does that mean? You got an increased transmissible virus that doesn't have higher virulence. So you would do a different risk assessment maybe to one who has a higher virulence. And so this is how we have to flexibly adjust our public health measures. And of course, the most important thing is to know that the vaccine covers it and the diagnostics. So I think those kind of information will be coming in the days ahead. But you're right in that, is there a probability that this could enter in Canada? Yes. The only way to stop it spreading is what we've just been harping about and like a broken record. So maybe I'll leave it there.
Follow up?
Yeah. And secondly, you talked in your initial remarks about how the next surge could be the worst yet. Could you talk more about why you think that's the case? Thanks.
Could you repeat the question? I couldn't hear it.
Would you mind repeating the question?
Yeah, I'm taking you off speakerphone. I don't know whether there's an echo. Dr. Tam, you talked in your initial remarks about how the next surge could be the worst yet. Can you amplify on that?
Oh, yes. The resurgence at the moment, as we've seen, is in terms of cases is a bigger resurgence than what we've seen in that first wave. And the more concerning aspect is the hospitalizations and ICUs, and also increasing mortality. We are seeing more outbreaks in long-term care facilities, but also in more remote areas as well. So in the first wave, if you recall, a lot of the more remote areas and our Indigenous communities, First Nations, were not impacted very much at all due to their diligence and leadership. But with the widespread resurgence right now, there's a much more broad impact across all areas of Canada. And if you've seen the impact in Nunavut, So it's for that reason, I think, and we're only getting into the winter. So we've got a few weeks ahead of us where people are sort of going inside. In the spring wave, of course, we were beginning to get into a season where people can, move outdoors and increase distancing, etc. So for many reasons, and the fact that people are just tired, and that their, intention to follow public health measures is impacted by that. So there's a behavioral human aspect to all of this, and our health workforce is exhausted. So all of these combinations just means that it's going to be much more difficult for us to manage in the next few months. At the same time, I've said, the vaccine gives us hope. We will get increasing numbers of people vaccinated, particularly after the first quarter. But the next few months is going to be quite challenging, I think.
Okay, we're getting close to the end of our time, so we're going to take one more question over the phone and then one in the room. So operator, next question, please.
Thank you. La prochaine question est de Caroline Desplanques du Journal de Montréal. À vous la parole.
Oui, bonjour, m'entendez-vous?
Oui.
J'aurais une question concernant les tests dans les aéroports. Dans vos commentaires précédents, il n'a pas été question d'implanter des tests rapides dans les aéroports. C'est pourtant ce que demandent plusieurs aéroports, le premier ministre de l'Ontario et celui du Québec. Quelle est votre position là-dessus? Pourquoi ne pas avoir encore implanté des tests? Est-ce que c'est quelque chose qui est envisagé?
Merci pour la question, c'est Dr. Njoo. Oui, il y a plusieurs comme des projets de pilotes qui sont en train de être en cours dans plusieurs aéroports. Je pense qu'on est en train aussi d'analyser les résultats. Je pense qu'il y a une pilote en Alberta aussi dans les autres provinces comme Ontario. L'utilisation des tests rapides à l'aéroport, c'est sûr, il y a des aspects très techniques. C'est quoi la sensibilité? C'est quoi le taux des résultats positifs? Peut-être c'est fausse, pas fausse. Il faut analyser toutes les données probantes avant de peut-être prendre des décisions, peut-être augmenter les efforts à nos frontières. Pour l'instant, on est en train de faire des projets. On encourage les projets de pilote et on continue à analyser les résultats.
Suivi?
Puis, s'agissant des deux vols en provenance de la Grande-Bretagne qui sont arrivés les derniers dans la nuit de dimanche, est-ce que vous pourriez être un peu plus explicite sur ce qui a été imposé aux passagers qui sont arrivés?
Oh, c'est Dr. Njoo. Oui, je pense que qu'est-ce qui se passait, c'est sûr que quand les vols de Royaume-Uni sont arrivés au Canada, il y avait des personnels qui sont là pour accueillir les personnes de l'avion et on a fait toujours nos mesures de quarantaine, un bon suivi, à poser des questions. Est-ce que les personnes étaient malades, tout ça. Donc, c'est selon notre comme régime de quarantaine comme d'habitude, mais c'est sûr avec un peu plus d'attention parce que ce sont des vols qui sont arrivés de le Royaume-Uni. Merci.
Et peut-être je pourrais juste ajouter aussi, comme le ministre Blair a expliqué, quand nous avons pris la décision d'empêcher l'arrivée des vols du Royaume-Uni, il y avait à ce moment-là, dimanche soir, 2 avions avec 301 passagers en tout qui étaient en provenance pour le Canada. Et M. Blair a bien expliqué que les représentants, les agents des services frontaliers ont rencontré ces 2 vols-là. Tous les passagers ont été sujets à des évaluations supplémentaires, une deuxième évaluation. Des détails sur leur plan de quarantaine obligatoire de 14 jours ont été fournis. Si les officiers responsables de la sécurité frontalière avaient le moindre doute, il y avait des mesures accrues qui ont été imposées sur ces passagers-là. Et il y aura dans les heures et les jours qui vont suivre, pendant leur quarantaine de 14 jours obligatoire, un suivi accru aussi, comme le ministre Blair a dit. Nous n'allons pas arrêter juste avec ces vols-là dimanche soir en provenance du Royaume-Uni, parce qu'il est probable ou possible que des passagers qui ont peut-être commencé au Royaume-Uni, mais ont transigé par un autre aéroport européen. Alors, toutes ces données-là sont dans les mains des officiers des services de sécurité frontalière et les questions seront posées pour déterminer est-ce que vous avez été, par exemple, au Royaume-Uni dans les 2 dernières semaines. Et si la réponse est oui, les mesures supplémentaires seront évidemment appliquées. Et comme le ministre Blair a dit, si quelqu'un décide de ne pas compter la vérité aux responsables de la sécurité frontalière, ils sont sujets à des peines assez importantes par la justice canadienne, des amendes qui peuvent aller à 750 000 des peines d'emprisonnement. Alors, nous n'avons aucune raison de croire que les mesures sévères ne seront pas appliquées et appliquées d'une façon rigoureuse pour toutes ces arrivées pour les prochaines semaines.
Okay, we're going to take one last question in the room. David?
Hi. Just a point of clarification. Are you saying, Dr. Tam, that everyone who receives a PCR test and tests positive, the results are genetically sequenced, and so the variant, if it did exist in Canada, it would be picked up? I just wanted to clarify that. And just for the ministers, why not give Canadians more assurance that you're going to do everything that you can to prevent this variant from coming into Canada by testing more passengers as they are arriving internationally?
Yes, so those are some of the options we're looking at. But of course, right now we've stopped the flights, and making sure that the enhanced border measures are being applied to anyone who may still be coming in, including the U.S. border. And at the moment, we're looking at what do we do after the 72 hours, and so that is. It's being worked out, and you will hear about that shortly. I think I just want to make a sort of erratum correction to what I think I said in terms of the numbers of sequences we've queried. It's actually 25,000 sequences, not 2,500. I think I said 2,500, but it's 25,000 sequences that are in our data bank at the moment. And we don't sequence every single positives. This is a sampling of them. And it takes quite a bit of effort to be sequencing everyone. But of course, you can do smart targeting of which samples now get sequenced. For example, if you're particularly interested in travelers and in certain countries, we can try and do some of that. Now, retrospectively, it's a bit more difficult because a lot of the samples don't have a tagline on it that says traveler from the UK. But prospectively, if they come in, we will be able to sort of sequence more of those. So what you're saying is true, is that we need to sort of increase scrutiny. The Alberta pilot has been an extremely good collaboration, and I think we will be examining the sequence from that pilot right now. And that will give us more information about the next steps that we can take in terms of the testing of travelers.
And if I might just add, thank you very much for the question. It's been our primary objective at the federal level to prevent importation from day one. And that is why we have some of the strictest measures in place in the entire world. Don't forget, in fact, in the US, people are not required to quarantine when they enter the country. We've maintained the 14-day quarantine because we know that that is the best way to prevent importations into Canada. And that's why, as Dr. Tam references, the pilot that we've co-funded and are co-leading with Alberta is so critically important because it is giving us a better understanding of the blend of tools that can help to alleviate quarantine time with the appropriate suite of testing ratios and timeframes. Don't forget, a test is just a point in time. I mean, we could test everybody at the border And if we did not have the quarantine, we would still lose a number of cases because, of course, if you don't test people at the right time in their illness, in fact, the test can be negative, and we could have people that are, in fact, indeed positive because they've received a test at the wrong time in the trajectory of their illness, then out in Canadian public, unbeknownst to them, spreading the illness. So that's why we've maintained the 14-day quarantine with such a degree of rigor. And of course, we do that in partnership with the provinces and territories, including obviously the first line, making sure that we contact everyone through Public Health Agency of Canada. We now have mandatory ArriveCan requirements, so people can provide information digitally. That way we can get information to provinces and territories more quickly. And of course, the enabling of all levels of law enforcement to enforce quarantine, which I'm sure Minister Blair can speak to a bit more in a moment. But I just want to reassure Canadians, that's why we've stuck with the 14-day quarantine. And that's why we've been reluctant to alleviate quarantine and introduce solely testing at the border. Now, having said that, I think as Dr. Tam said, the important thing is the research and science that's being developed through pilots like the Alberta testing pilot that will give us clarity and scientific assessment that can allow us to make decisions about how we manage the border going forward.
Thank you. And David, just if I may just add a few remarks. I think, unfortunately, over the past few days, we've heard a number of comments which frankly are an unfortunate misrepresentation of what is actually happening at our borders. And I think for the purposes of addressing Canadians' concerns, it's important to clarify. Since March, Canada has actually imposed some of the strongest border restrictions of any country in the world. We have, since March, restricted all non-essential travel from international destinations, including the United States. You know, we took extraordinary measures that most other countries in the world have not taken. And for example, and as you've heard, the United States has not restricted non-essential travel and has not ordered arriving passengers from international destinations into quarantine. But Canada has, rigorously, since March. And we have implemented those measures also at our land border with the United States. You know, previously almost 95 million people crossed that border each and every year. We've seen a very significant reduction in the number of people crossing our borders because of the effective measures that we put in place. And our public health agency officers and our border service officers have been working very closely and very collaboratively to take significant additional measures at all points of entry and at particular at the airports. In every case, all non-essential travel, all travelers are screened for any symptoms and for where they have traveled. We collect a great deal of information now digitally through the CanArrive app so that can facilitate the program that we have put in place for testing and tracing of those individuals and ensuring compliance with quarantine. As Minister Hajdu indicated, everyone coming into this country and as a non-essential travel is ordered into quarantine. And as I mentioned earlier, there are very significant consequences for either misrepresenting your travel itinerary to the border service agencies or failing to comply with PHAC's order of quarantine. We have imposed some of the strongest measures of any country in the world. And when we saw the emergence of a new variant in the UK, we were among the first countries in the world to take protective action to protect Canadians. We have not been slow and not been unresponsive to the concerns that Canadians have. There's a suite of measures that are being implemented right across the country. We continue to look for opportunities to enhance. As Minister Hajdu mentioned, we have been piloting, for example, with the province of Alberta because they wanted to look at testing as a way of shortening the quarantine period. But as Minister Hajdu also indicated, testing is not an absolute guarantee that the illness will not come into the country at point of entry. And so we have implemented a very rigorous suite of measures. And I want to just reassure Canadians, those measures have worked. It has been extremely effective. We know that it's been difficult. We know that it has caused hardship for many people, but we have been able to maintain essential work and essential supply lines for this country. And at the same time, we've been very effective in restricting non-essential travel. It's also important to recognize Canadians have a right to return to Canada. But when they return, they are subject to mandatory quarantine, which is put in place to protect us all and those returning Canadians from transmission of the virus. And as we've seen, only a very small number of the transmissions that have been identified in Canada were the result of international travel, most of those as a result of people returning from spring break or snowbirds returning from their winter residences earlier this year. But we continue to impose very rigorous measures. And I want to take the opportunity to acknowledge the excellent work that is being done by the Canadian Border Service Agency and the Public Health Agency of Canada in collaboration with their provincial authorities and police of jurisdiction. Everybody is working very hard to protect Canadians, and the measures that Canada has put in place to protect our borders and to ensure that this illness is not brought into the country from international destinations have been rigorous and they have been effective. And so the characterization that unfortunately some have made does not reflect the accuracy and the facts of what is taking place at our borders. And I want to assure Canadians that our officials are working very hard to ensure their safety and their health. Thanks.
That's all the time we have today, so thanks for joining us, everyone.
Thank you. Merci. The conference has now ended. Please